Hello, and welcome to the second session of the McKnight's Online Forum, COVID-19 Update 9, a joint educational effort for the readers and audiences of McKnight Senior Living and McKnight's Long-Term Care News. This webinar is entitled COVID-19, How the Vaccine Will Change Senior Living Marketing in 2021 and Beyond. I'm McKnight Senior Living Editor Lois Bowers, and I will be the moderator. After a year of hardship, we finally can see a light at the end of the tunnel in the form of the COVID-19 vaccine. Your residents and their families, however, have many questions. When will the vaccine arrive? What will the process be? Where can I learn more about the vaccine? You'll want to proactively communicate about vaccine availability and related questions. Today you'll learn how online search activity has changed in response to the announcement of the vaccine, what information you should be sharing and where, and what changes to expect related to senior living reputation, experience, and marketing in 2021. We'll hear from our speakers in a moment, but first we have some housekeeping matters to take care of. First, today's slides are available for download. Just click on the Handouts tab on the left side of your screen to find a PDF of the slides to print out. Next, if you are having any audio problems with this broadcast, please first check the volume control on your device. This is the most common cause of hearing issues. The sound should be coming from your computer speakers. Also, we will have time for questions and answers near the end of today's presentation. If you have any questions about the information presented, please feel free to send them directly to us at any time during this hour by clicking on the Questions and Answers tab on the left. Questions that we don't get to in real time will be answered afterwards. This educational offering has been reviewed by the National Continuing Education Review Service of the National Association of Long-Term Care Administrator Boards and has been approved for 1 clock hour. You must stay tuned to this event in its entirety during the original broadcast to receive a certificate, and each attendee must sign in and listen on a separate computer. Attendees can track CE requirements through the course completion tracker, which is accessed through the last icon in the area below the open webinar panel. Once you have achieved 50 viewing minutes, a View Certificate button will display and the required viewing duration will have a green checkbox. You then can view and save your certificate. A copy also will be mailed to you afterwards. Today's program is made possible by support from Reputation.com. After this webinar, you can view the company website at Reputation.com. And finally, this session will be archived and available on demand shortly after this live broadcast. You can access it again, or others can experience it for the first time by visiting the registration page to enter this studio. The URL is mcknights.com/012621online forum. And now I'd like to introduce today's speakers, Samantha Prinster and Annie Harmon. Samantha Prinster is the Director of Marketing and Communications for Cedarhurst Living. There, she is responsible for developing and implementing marketing and communication strategies for all Cedarhurst senior living communities, in addition to aiding in business excellence projects. Before her time at Cedarhurst, Samantha worked in various healthcare settings and also spent time as the digital marketing manager for a global nonprofit organization. She holds undergraduate degrees in English writing and marketing management from Southeast Missouri State University, as well as a master's degree in communications management, a strategic leadership in healthcare certificate from the University of Denver, and a master's of healthcare administration degree from Maryville University of St. Louis. Annie Harmon is Head of Strategic Consulting, Healthcare, and Life Sciences at Reputation.com. There, she provides strategic consulting and data-driven insights to try to maximize value, drive acquisition, and improve retention for healthcare brands and senior living communities. Before her current role, Annie directed strategy for digital consumer experience at Ascension, a national healthcare brand with 2,600 locations, including 54 senior living communities across 12 states. Previously, she led digital strategies in the pharmaceutical, nutrition, healthcare, and education industries. She has a Bachelor of Arts degree in communications and an MBA with a minor in data science and business intelligence. You can read more about our speakers by clicking on their biographies provided as part of this event. More importantly now, please let me turn the microphone over to them so we can get to our important subject matter. Annie and Samantha?
Thank you so much for the introduction. And I wanted to cover, first of all, what we are going to be learning today. And it's going to start with just a little bit of context about where we are as an industry, the trends that we're seeing as we head into 2021, and how that's going to impact sales and marketing efforts as a whole. We're also going to talk about the specific managing reputation and experience issues related to COVID-19. There's been a lot of impact to your community's online presence, and especially most recently with vaccine communications. So we're going to be sharing some ways for you to optimize your communications around COVID-19 and vaccines. We'll also cover how to use feedback data to improve the overall resident and employee experience, understand their perceptions, and make improvements based on feedback. And then, of course, the best part of today's session will be the case study from Cedarhurst Senior Living, which Samantha will be sharing. And she's going to share how Cedarhurst has used a variety of tactics to communicate during the COVID-19 crisis and how they are now using online channels to convey information and combat misinformation and get the word out about protocols and vaccine distribution within the communities that they serve. So let's first start by tackling the current trends that we are seeing for senior living. Now, obviously, the senior living industry has experienced a lot of change and a lot of impact from the pandemic of 2020. But what hasn't changed is that experience management continues to be a priority for those who are looking for care. They want more from their experience. It's not just about the clinical experience or living somewhere. It's the only industry where the consumer is experiencing your brand 24 hours a day, 7 days a week. And so that experience has to be improved. The other piece that connects to this is consumer choice. And we are seeing more and more that ratings and reviews influence that choice. 85% of consumers trust online reviews as much as a recommendation from a friend or family member. And that's really important because, as we know, that persona, the buyer persona for sales and marketing within senior living is typically going to be that adult child of the senior, and most likely the eldest daughter. You know, they are the ones who are looking at ratings and reviews. They are using digital tools to get that experience of that community before they make a decision. And so it matters what your ratings and reviews look like online. We are seeing that occupancy is at a historic low right now. A lot of that is due to the fact that move-ins had been paused in many markets throughout the U.S., while move-outs have been on the increase. So it's really important that all of us as marketers keep an eye on those occupancy numbers and start driving leads for a lower cost per conversion and driving more leads where they are needed to get those occupancy numbers up. We're also seeing that many consumers are still afraid. They are concerned about safety with their senior relatives. They are concerned about their own safety if they are to move into a community living situation. And so those perceptions have to be combated as well. And then, of course, caregiver burnout, which has been a concern even prior to the pandemic, has reached really, really critical levels. And Samantha, I know that you've seen a lot of this within your organization. Can you talk a little bit about caregiver burnout that you've been seeing and how we can address that?
Of course. Annie, very similar to what you said, our industry truly has always battled against caregiver burnout. But 2020 has really shown pandemic fatigue. Each of our communities have gone through stages of being short-staffed due to positive COVID tests, potential exposure, needing to quarantine, which has led to every department needing to step in to keep our residents safe but also fulfilled. So this could then lead to long hours and, unfortunately, burnout. In addition to caregiver burnout, we're also finding that we're having to battle PPE fatigue. It can be daunting for staff members to continuously wear N95s, full PPE, including gown, gloves, face shields. But it's not just senior living facing PPE, it's like really the country as a whole. So even if our caregivers in the community are wearing PPE, if they encounter those in the public not wearing masks anymore due to PPE fatigue, it can lead to potential exposure, which then leads to quarantine, increasing other caregivers to step in, which may lead to burnout. Being a caregiver is hard. I was a caregiver for many years, and I know how much work it takes, and that was pre-pandemic. During COVID, our caregivers are working, I feel, 10 times harder, and we are now seeing that hospitality jobs are resurfacing, such as restaurants opening back up, hotels. So this gives our caregivers the opportunity to potentially look into other industries for a position that may have less stress. So it's really important to be mindful of burnout and really show the significance of staff appreciation. Battling burnout is hard, and COVID-19 made it harder, but as long as we're really showing appreciation and being by their side and supporting, I think that we have an opportunity to work past it.
It's so important, and the thing that strikes me about what you and I have talked about, Samantha, that I think is really critical is this idea that the consumer and, this idea of consumer experience, the consumer can many times be our own caregivers and our own providers within the communities, those who are working with the residents to improve their quality of life. They are consumers of our brand, and so it's important to make sure that they are feeling that appreciation and to check in with them as well. So I want to talk a little bit, while we're talking about consumer experience, talk a little bit about the way that sales and marketing and consumer experience have really come together, and the pandemic has accelerated this as well. You heard from Samantha talking about the challenges of COVID fatigue and the challenges of burnout and having to go through all of these extra protocols. It would be easier to just go into another industry, and we're seeing some of that happen. So really to think about the experience of our providers and the experience of our residents as a singular brand is really important. So when we think about this, the reputation and the experience management as a complete program, that means bringing together sales and marketing and consumer experience teams and concepts. So this is really a unifying model where both areas can complement and empower each other to reach the goals that are outlined here. Sales and marketing is looking to improve visibility. The experience team is looking to improve access to the brand. And once they have access to that care, you really should start collecting feedback and highlighting that feedback from satisfied residents, from your staff, from the family members, from volunteers. This is going to increase your volume of ratings and reviews and online feedback, which will then serve to increase future conversions. And we'll talk about how that happens in today's session. The third thing that you are doing by pulling all of this together is to create a single hub for all of your feedback to be in one place so that you can understand your brand sentiment. You understand how people are feeling about your brand. Do they feel that you're taking the right safety precautions? Do they feel like it's too much? Is there a burden? Is there a disconnect between the protocols that you've put in place and what your residents actually see and are experiencing? So there are ways to look at all of this and see if there are areas operationally that you need to look at in order to improve that overall experience. And as the line between marketing, sales, consumer experience, as this all continues to blur, your brands are finding that there are too many feedback sources that are either siloed off or disconnected from one another. And so in today's session, we're going to talk a little bit about how you can bring all of this together and start analyzing it to represent the holistic voice of the customer for your brand. And, I know you, Samantha, you've talked to me in the past about that connection between sales and marketing and experience. So how has your organization started to look at this as a whole?
The connection between sales and marketing is truly imperative for success. Our organization really identified the need for a unified front in sales and marketing, and therefore put a good focus on sales enablement. Through sales enablement, we've been able to ensure that whatever the marketing team is creating and putting together is being communicated to our sales team on the ground, but then also it's ensuring that training is occurring so that the tools that marketing is providing the sales team, they know how to use, they feel empowered to use, and they feel strong in that use and helping them in their positions. We've really put a lot of focus on analytics through all of this. And what's great about that is that it's allowing us to make decisions based on data that further align sales and marketing. We're really becoming a unified front in one unit. This connection has allowed us to continuously look for ways to streamline and remove complications so that our directors of sales are successful.
Yeah, I think that's a really good point, and I think that's a really good transition into, the way that we are responding to COVID-19 as an industry. We can no longer afford to have the silos that maybe existed before. We all have to start breaking down those barriers and working together across functions and across regions, and really looking at what that entire experience of the brand is, so that we can have a unified response to COVID-19. And so I want to talk a little bit about some of the overall ways of responding to COVID-19 that we have seen. And this will really set up the case study that Samantha is going to share. When we talk about search engine optimization, the old way of thinking about this is, what does my website look like, and how can I get my website to rank number one in Google search? And of course, as you can see from this example, Cedarhurst has done just that. They are number one in search, and in fact, they're also doing some paid search that is showing up in search results as well. But what you'll also see is that there is so much more to search engine optimization than just your own website. In fact, the vast majority of search traffic is not going to be coming to your website. It's going to come to these other sites, these third-party sites that can either validate what that brand experience is, or they can be inconsistent. And so what you want is to own not just that first or the first two results on Google, but you want to own every single result that comes through on that first page of Google. And the way to do that is by managing all of your third-party listings. You have to get that information out there so that the message they are seeing on, let's say, caring.com or a place for mom or whatever the site is, that is consistent with what they are seeing on the Google Knowledge Panel, and that it's consistent with what they are seeing in your brand website. It has to be consistent. That consistency is really key for search optimization, because consistency is one of the factors, accurate data, that Google is going to use when ranking your listings for your brand. And so, Samantha, I know you have a lot of experience with this, and obviously the example here is from Cedarhurst, and it couldn't be more perfect here because it looks like you've gotten all of those pieces. But what are some of the tactics that you are using within Cedarhurst to ensure that your communities look good when people are searching for them online?
Yeah, I think this is a great topic to cover right after we talk about sales enablement, because this is a perfect example of just assuming that our prospect journey is aligned, and it really shows that it can't be just one directional anymore. Anything that they see online really needs to feed into the in-person experience. We've known over the past few years that, the use of search engines like Google has allowed prospects and adult children to do research on senior living prior to contacting. But it really wasn't until 2020 that the pandemic led to where almost all transactions or communication initially before anyone contacting us was done online. This led to us taking a deep dive into our search engine results and teaching our communities how to utilize a virtual drive-by. When I say virtual drive-by, what I'm meaning is when you go onto the search engine like Google and you search Cedarhurst of Beaumont, everything that pops up, that's the drive-by that a potential prospect is going to be looking at before they ever pick up the phone or contact you via the form. So you really need to ensure that the photos on Google align with, what you would be presenting in person, that the reviews are good. Third-party listings are accurate. Not only is it so that everyone is getting the information correct, but then also when they show up in person, it's just that business continuity and brand consistency from the online experience to the in-person experience. One thing that has truly helped us with this is managing all of our listings on reputation.com. So we have been able to tie in our caring.com, Senior Advisor, Google, Facebook, all within that platform. So when we update one, it'll automatically update the other. But then in addition to ensuring that everything's accurate from the corporate office, it's then working with the communities on the ground so that they know everything that's on there and they're able to leverage it to just ensure continuality.
Thanks, Samantha. That's really that's a really important point, that keeping that consistency of the experience, not just from the corporate level, but also down to the single location. And as you can see from this example on the screen, when it comes to local search, your digital presence, especially with the pandemic, is so important, because that entry point has shifted from either your brand website or your actual location. It has shifted to Google. It's really the top of the funnel now. And the better optimized your Google presence, the more people are going to take action on what they see, and the more likely you're going to stand out from others. And one of the things that we have seen as a whole in the past year is this increase in comments around safety, and consumers are concerned about safety in all of the businesses that they patronize. But particularly when it comes to senior living, that is a very, very personal experience. It's not just going to a restaurant and making sure that they are sanitizing the surfaces. It's making sure that those who are the most cared for people in your lives are being treated with the utmost safety in mind. And so what we see a lot of is in ratings and reviews, safety has come up in 2020 and in 2021 more than it ever has before. And a testament to the good work that's being done within the senior living communities. A lot of mentions of the safety protocols that are in place, and it's also a testament to where consumers are feeling right now. And so, as we look at that consumer journey, it's really important to keep in mind how you appear on Google, because that is going to be the entry point, and the feedback is going to influence that search algorithm to rank you higher in your visibility. Samantha, I know that you really had to bring together some of that in-person experience and the virtual experience. Can you talk about maybe what's different and what's maybe the same from what you were doing before and what you're doing now, particularly with this virtual search experience here?
Of course. The pandemic really pushed senior living to bridge that gap between communicating virtually and in person. And even though the pandemic may have changed, visitation policies, one thing has always remained the same and consistent, and that's that there are still seniors that need help. There are still adult children who aren't sure where to start in the process, and therefore, Cedarhurst and other senior living providers really needed to pivot in order to continue to serve seniors by embracing digital means. So that included, ensuring that all of our platforms and information was updated with not just what we offer in the sense of care levels and, who to contact for more information, but then what we're doing from the COVID pandemic standpoint for safety and on-site testing and screening, really ensuring that all that information is out there, because we need to ensure that we are taking, our infection control and safety practices seriously. Another pivot that we did was by embracing, digital sale platforms such like Zoom, completing 3D tours of our communities, and leveraging online platforms that will allow this shift to where a prospect or adult child, regardless of where they are at, are able to meet with our executive directors or our directors of sales virtually to still receive the help that they need and to still continue that conversation. We've learned that, of course, virtual communication is not going to replace that in-person experience, but it is going to aid to it. The first communication now might be over the phone or over Zoom, whereas before it could have been someone just walking into the community. So really ensuring that transition to meet virtually wherever that prospect is really important in just being a partner in the search for senior living, because as you said, it's a very personal and a personal decision and something that cannot be rushed.
Absolutely. And, it's interesting this, I was speaking to someone earlier this morning who is overseeing marketing and reputation and experience for a senior living community. It's not an assisted living. It's more of a senior living community. But his point was that, with all these digital tools that are being adopted, there's this natural inclination to assume that our seniors aren't going to adopt them quickly or won't be able to use them. But what they have seen is that the seniors have actually picked things up quicker and are more technologically savvy than some of the staff in some cases. So I thought that was interesting. It just shows that, as we go through this new normal, some of those prior assumptions that we have are no longer applicable. So, as you think about how to move forward and what is the right way to use consumer feedback and make improvements, especially in this strange, unique time that we are in, perhaps you're already collecting feedback. Maybe you're collecting feedback from different audiences. You're doing surveys, or you've got ratings and reviews out there. But a common challenge that we see across senior living organizations is that this feedback data lives in silos throughout the organization. Maybe the sales team has feedback that's coming in through a call center, and that lives in the CRM. And maybe the family members and caregivers are being sent a survey, and that lives with the experience team. And the donors are asked for their feedback, and that lives within a different software. And so you have all of these sources of feedback that can be used and can be pulled into a single hub. And by bringing all of that together and starting to break down those data silos, you can start to look at things and analyze the different categories for sentiment and analyze the experience that's being had. And the great thing about breaking down all of these feedback silos is that you can start to use that with your business intelligence software. Maybe you have an analytics team, or maybe you are contracting that out, or maybe there's a business analyst within your organization that can create customized reporting around this, looking at all of the data and being able to analyze those areas for improvement. And so this will give you a full scope, that holistic customer voice, whether it's the experience of the brand as an employer or the experience as a provider of care. You really want to understand all sides of this. And so Samantha, I'm curious how you're using feedback for operational improvement at Cedarhurst.
Yeah, Annie, I love that you mentioned using feedback to break down the silos of where data is being housed. Like many other organizations, we have various tools for specific things, such as, an EHR and an employee platform for scheduling, both of which allow us to get feedback. On Shift allows us to get feedback from employees, and CareMerge, our EHR, has a family engagement aspect to where we can use NPS scores to kind of gauge, how our families are, feeling about our services. When you take those two, very important pieces of information and then match it with, the reviews that are being left online, we utilize after tour surveys, after move-in surveys, and then, of course, resident satisfaction surveys. You can piece these things together and to really get an idea of what is, areas that we are excelling at and what are areas that we might be able to improve. A tool that we do use that Reputation offers is Operational Insights, which has been incredibly beneficial in getting an analytical view based off of our online reviews. So it will pull, sentiment areas of things from the reviews of where we can improve or excel at. And then we're able to take that information, pair it with NPS scores and feedback from employees to then work one-on-one with our communities, whether it's to congratulate them and show appreciation for all the areas that they are doing great at, but then also coach them on the areas that we can further enhance. A great mindset of our organization that I'm truly appreciative of is our sense that everything and always can be improved. We have a very quality improvement mindset. Even when you think something is top notch, you can take a deep dive and make it even better. And so leveraging feedback into a central hub and then using that not only to improve our brand awareness, our reputation, but then also to improve, our operations, our care. It's just really allows for that 360 view of the organization, and it brings people together, which is an important aspect that I think gets overlooked quite frequently.
That's so important, and I'm really glad that you highlighted that because, a lot of the confusion around, why do I have so many data sources and why are they all so important? It's not that one is more important than the other. It's really about looking at everything. And you mentioned a few different sources of this data. And one of the terms that we use a lot within the experience management world is the difference between structured data and unstructured data. So when you look at the way that structured versus unstructured has affected our surveys and the experience during the pandemic, you can see that a structured example would be, did you receive a mask when you arrived? Yes or no. Or do you have an N95? Yes or no. Unstructured data would be, how do you feel about the safety precautions that are being put in place? And then having open text to be analyzed, because it may be that you are all of the right protocols and doing all of the right things, but unless that is communicated or presented in a way that gets through as a storytelling element, the perception of that safety could be very different. And this is really coming into play when it comes to the vaccine communications as well. And so I love what Cedarhurst has been doing to really get that information out there using structured data, information that they can put out there in fields online, to address unstructured sentiment, which is the fear and the uncertainty that is out there around the pandemic and the vaccine in response. So I think that's a perfect place to transition to the case study, Samantha, that you're going to be sharing with us today. I'm very excited about this. I think that you've done some really impressive work. So I'd love for you to take it over and tell us how Cedarhurst has been managing consumer experience, both leading up to the pandemic as well as what you are doing today, and how 2020 was for you.
Thank you, Annie. I'm very much looking forward to sharing this case study and just, hoping that maybe others can see the benefit of online reputation. So before I kind of jump into things that we've done to improve our communication, just to give a little background on who Cedarhurst is. Cedarhurst was founded in 2007, and we are an experienced operator in independent living, assisted living, memory care, and supportive living. Currently, we are operating 46 communities in 9 states, and we have 9 under development. Right now is a very exciting time for our organization as we are approaching the 50 operating mark, and it's just very exciting to be a part of that, but then also to see how it's just impacting our day-to-day and how, as we grow, we further enhance and improve. Just to give you guys an idea of the states that we are in, you can see we are in Georgia, Florida, Oklahoma, Illinois, Missouri, Indiana, Kentucky, and Michigan. So things that we identified early on were certain needs that we were going to have to accomplish. These included understanding and improving the resident experience, providing transparency about all communication and what we are doing pre and post pandemic, but then also enhance our presence regionally for locations. One way that we identified that we needed to do that was by collecting and analyzing feedback in a streamlined manner, dynamically pushing up-to-date information on Google and our business sites to ensure that everything we are communicating is the most recent and up-to-date, but then also requesting and responding to public feedback. I think one of the biggest things of this list is ensuring responses, whether it is a positive, negative, or a neutral. Responding to those not only helps us improve as an organization, but it also then shows our commitment to our prospects, residents, family, and staff, and how we want to be their partner in really the senior living industry. At the start of 2020, we actually launched a Google review program. We launched it in January, so it was quite literally right before the COVID pandemic. What we did was we put together a Google acquisition program that all of our communities participated in. This included equipping the communities with what we called review kits, which included just, supplies and tools that they could use to ask for reviews, such as, a business card size that they could put in, a tour pamphlet saying, if you enjoyed your tour today, please put in a review, let us know how it went, information on how to ask for a review, how to, if someone says, how do I create a Google account, to provide that information. We really just wanted them to feel equipped and empowered to ask for reviews in the sense. We also provided training on why they should do that. We really identified that although our communities knew that, yes, online reviews, you want it to be high, they really didn't understand the why behind it. And so this campaign, I truly believe, was successful because not only did it make our communities active participants in their online reputation and help them take control of that digital drive-by, but it also showed them that ultimately your online reputation is a critical part of the sales process. We started the campaign as a way to, empower communities to take control of their online reputation, but then it turned into not just a one-time campaign, but a routine that they continue to follow. And that routine allowed us to be able to still leverage that throughout the pandemic. We've been able to continue to receive reviews during the pandemic from our communities, communicating with our residents and families and third-party partners to where the reviews are being able to show to potential prospects that, we do feel safe at Cedarhurst. They are, providing A, B, and C during this pandemic. And it has helped us, to really realize that you should never be waiting for the next crisis to happen. You should have this review program already in place and built up because it'll show credibility to all stakeholders and constituents, but then also it then becomes just a natural part of our team's day-to-day. And in all honesty, it's really just helping them to showcase the great work that they're already doing. They're just, asking for assistance and showcasing that. Through that campaign, we were actually able to increase our online listings, increase mobile calls from listings, and increase our overall star rating.
That's so impressive, Samantha. I mean, the 4.6 out of 5 stars average across all of your locations is, especially during a time when there is so much fear and concern for the industry as a whole. I'm so impressed by those results, and I think it just proves that this can be done even in a crisis, and it can be done in the senior living industry when there is so much challenge around this. I want to congratulate you for that number. It's just incredibly impressive, and I'm certain it's going to go up even more this year as we look to come out of the acute stages of this crisis.
Thank you. It was really exciting to see our communities get excited and take control of, their online reputation and those listings and really be a huge part of it. It was just a great campaign overall that then has just resulted as a part of our culture, which has been really great to see. So a big area that we are talking about today is communication during the pandemic, and especially right now in regards to the vaccine distribution. Early when COVID-19 first, hit the spotlight, we immediately identified that we really had to have a central location that we could direct our families, residents, staff, and prospects to learn everything that our organization was doing as a whole for the pandemic. And now we have shifted that communication to not just be our response to coronavirus, but now shifted to the vaccine. We created a dedicated landing page on our website that outlined our response, our policies, where to get additional information. Right now, we even have a whole section dedicated to the vaccine in the sense of, our vaccine calendar of communities and when they're getting the first, second, and third clinics, including dates and times. We have, Q&A information regarding the vaccine. We partnered with, physicians to offer educational materials. And we really learned that not only does this site need to be something that provides information on what we are doing, but it also needs to provide resources for our families, staff, and residents to feel empowered in being fully informed. Even that's something as simple as we have on our site offering, how to use FaceTime was beneficial, especially at the start when families and residents were transitioning into virtual visitation, which we found to be, very useful, because although it might be something that we think everyone knows, it very well may not be. In regards to the vaccine, not only are we communicating on this central website, on a central landing page on our website, we are also connecting various communication tactics. This includes email, text messaging. We utilize social media. We have been mailing informational packets to homes and utilizing our Google My Business pages. And so we really want to, some examples of these is the packets included, here is how we're handling, the vaccine distribution. Here's what we know. Here's clinic information. But then we want you to be able to make an informed decision. So here is, a myths sheet. Here's a Q&A sheet. Please join us for a webinar with our Chief Medical Officer to talk about the vaccine and to answer any questions you have. Through text messages, we have been emailing our staff weekly with, Q&As or myths to kind of just help them feel informed so that when it comes time for them to receive their vaccine, they feel like they're making the right decision for them. And this also goes for our family members and our residents. It's important that, yes, we are communicating to our residents and staff, but we want their families to be just as informed, because we are not just here for our residents and staff. Of course, their safety and well-being is our top priority, but we consider their family members part of the Cedarhurst family. And so we are doing all that we can just to ensure that there is communication, thorough and at their fingertips to anyone looking for it. A great feature of the Google My Business pages that we have been utilizing is the Q&A feature, in particular to the vaccine. You can see on this screen a copy of the Q&A piece that we included in the mailed packets to homes, and then you can also find this on our COVID response webpage. But in addition to that, we took those questions and then put them on each community's GMB profile. So then if someone's just, searching for us and they want to know information about the vaccine, they don't ever have to leave their main search area. They can look over at the Google My Business profile and receive information on that. Not only is this great in helping to spread information, but it's also improving our search rankings, which then helps us own that search profile that we talked about earlier. A great feature of Q&A, that's not just great for COVID vaccine communication or what we're doing with the pandemic. It's truly a great platform in general that really allows individuals to post questions and gives us the opportunity to answer them in real time. Having a timely response to any question that is posted for us not only increases our visibility, but it also increases our credibility and our commitment, which is, very important during these times. So really the last thing that I wanted to kind of share in regards to, what I have learned over the past year in regards to, COVID and communication is, 3 main takeaways. First, it's very important to make the best first impression. And, right now we know that first impression is online. Going back to that digital drive-by of your community or business and ensuring that the information is what you want people to see and take away, whether that's reviews, photos, third site listings. It's all very important to keep that all in mind and to leverage not only online, but also whenever a prospect comes into your community. The second key takeaway is just, having a review acquisition program in place. If you don't have one now, I strongly encourage you to put one in place, just so then it can help not only for communicating and showing new people to your communities what all you are doing and the great things you are doing and care you offer during a pandemic, but then also beyond. It's just a great tool to have. The last takeaway, and probably one of the most important ones, is that it's no longer in person or digital. It's in person and digital. As I said earlier, the pandemic has truly changed the prospect journey, and it's no longer one directional. It will flow back and forth from online to offline. Yes, physical locations will continue to impact the brand perception and to create those relationships to really, nurture the sales process. However, there still has to be that seamless transition from online to offline interactions. Now more than ever, consumers are used to utilizing digital channels for research and purchases. So we have to be able to adapt to being able to meet in person, but also to meet virtually. We know decisions are not made 100% online, but they're no longer made 100% in person either.
Samantha, thank you so much for sharing your story today. As we get ready to open up for Q&A here, I just want to point out that we have a couple of resources available for download, and those are provided here in the handouts for download that are available within the webinar. I want to open it up to Q&A, and it looks like we already have at least one question here. A couple of them have come through now. If you have questions, please post them. But I would love, Samantha, for you to take this first one, which is, how do you handle reviews that maybe aren't relevant? They might be from disgruntled family members or maybe a former employee. Some of these aren't even driven from facts. They're emotion driven or are taken out of context, or maybe aren't in the control of the brand. So what are some things that you've faced, and how can brands manage that?
That is a great question, because I think we all, especially this year, learned that many people don't realize that our policies are kind of derived from state regulations. Great example is, states are restricting visitation to senior living communities, and families don't realize that it is coming from state regulators. They think it's just our communities restricting it, or, disgruntled situations. What I have found it to be very impactful is when we get a review that's negative, before I ever respond, I immediately contact that community or the person the review is directed towards and ask them, tell me more about this family. Tell me more about this situation, so that I can be fully informed in what's going on. And then from that, I'm able to craft a response that not only outlines that's very unique to their situation, but encourages them to contact us to discuss further. You know, a lot of times we have found that it's not necessarily, you know, they are truly unhappy. It's more that they want to be heard. They want someone to listen to them, to take their situation seriously, and to communicate to them on what we're going to do to fix that situation. So ensuring that our responses are factual, fully addressing the situation, and then offering to discuss more has been extremely beneficial. And in regards to like CMS regulations and things like that, we have referenced, you know, those things in our responses at time when appropriate.
That's really a good point. And one of the things that can be a tendency in senior living is to focus on that one negative review that comes through when, you know, as you've done with your brand, requesting feedback before it's actually needed is so good for improving that brand overall and actually burying some of that negative sentiment. You know, the more positive you've got out there, if you've got 10 positive reviews and one negative one from a disgruntled family member, you know, it's not going to have the same impact as if you just have that one review out there that's negative that you haven't responded to. Do we have other questions? I'm not sure. I'm looking through here. Here we go.
Yeah, I was going to say, there's some questions about priorities. If you have a limited budget or limited time, where can communities start to make the biggest impact with their limited resources?
You know, honestly, I would put your attention to digital first right now, really focusing on what is your Google rating? Are you getting reviews? Trying to start there and then get, you know, a review program in place, and then focus on your third-party provider or, you know, website to get that information updated. You know, you don't have to put monetary value into like your GMV or third-party provider sites, but just having those updated with information on them, that'll help to increase your visibility.
Yeah, and one thing that I would note there too is that Google loves its own products. So if you have to choose between boiling the entire ocean, you know, feeding all of those third-party sites and just focusing on Google to start with, I would definitely recommend focusing on Google and getting your Google My Business listings in shape, because Google's going to always prioritize its own products in the search panel.
Great. Thank you for those insights, both Annie and Samantha. I think that's all the time we have for questions today, but again, if your question wasn't answered during the webinar, you will be followed up with to make sure you get the answer you need. We hope you found today's webinar helpful. This session will be archived and available to listen to again shortly at the address on your screen, mcknights.com/012621 online forum. We'd like to give special thanks to our speakers, Samantha and Annie, being with us today to share their insights, and thanks to our sponsor, Reputation.com. You can visit Reputation.com to learn more about the company. Be sure to attend the third webinar in this online forum event, How Nutrition Support Can Boost Resident and Staff Immunity During the COVID-19 Pandemic. That session will begin at 1:30 p.m. Eastern Time in this same studio. Thanks to everyone listening for tuning in. This is Lois Bowers on behalf of McKnight's Senior Living and McKnight's Long-Term Care News.